Hi, in this video I'm going to be demonstrating a general lung assessment including palpation, percussion, and auscultation. So to start off, I'm going to be doing palpation. This includes chest expansion and tactile firmitus. So with chest expansion, I'm just going to make sure that the patient's lungs are equal and symmetrical with when he inhales and exhales. So I'm just going to take my hands and put them at the base of his lungs and then ask him to just breathe in and breathe out deeply, and I'm looking for making sure that they are symmetrical. So just breathe in and breathe out. Okay, good. Okay, and then for tactile firmitus, it is a palpable vibration that is generated from the larynx and can be transmitted through the chest walls. So with this, it's not so important that I'm making sure that the firmitus is intense, but I'm making sure that they are both equal and symmetrical on both lungs. But an increased intensity, it could be a sign of ammonia, and then a decreased sign could be, or a decreased firmitus could be a sign of maybe like some kind of obstruction pathology. So to do this, I'm just going to take the ulnar side of my hand and I'm going to work down his lungs on both sides together, and I'm going to ask him to say 99, feeling for that even vibration.
99, 99, 99, 99, 99, 99, 99.
Okay, and so next is percussion. So this also happens on the posterior side, and there are 8 different sites. I'm just looking for a transmitted sound that happens through the body cavities when I'm tapping. So there is a direct and indirect method to percussion, but I'm just going to be doing an indirect for this video, which consists of me taking both my hands, and one hand is against his back while the other middle finger is tapping along those 8 sites. So for a normal percussion, it would be just a general resonance that is low and hollow, versus maybe like a hyperresonance would be an abnormal finding, and this would be like a loud or booming sound. It could be a sign of COPD or maybe emphysema. So again, just going down both sides of his lungs, on his back, and listening as I go. Okay, and then lastly is auscultation. So I'm just using my stethoscope to look for normal versus abnormal adventitious sounds. There are 4 main adventitious sounds that would be abnormal, such as crackles or wails. This can be caused from fluid in the lungs, such as pleurisy. Could be a condition of this. A second one is wheezing. This is really common in asthma. It's caused by an obstruction from mucus in the airways. It kind of sounds like a musical, high-pitched wheeze sound. And then next is bronchi, which would be like a lower musical sound, which is caused from trachea obstruction, such as COPD. And then lastly is stridor, which can be in the tracheal larynx, and it's a blockage, and a condition of this might be croup. And then there are 3 normal sounds that I would hope to hear. This is like a bronchial normal sound. This happens in the trachea. The second one is bronchiovesicular, which kind of happens in the center of the thorax along the vertebrae. And then lastly is vesicular sounds, which happens directly in the lung tissue. So I'm looking for a normal sound with this would be strong, loud sounds that are equal with inhaling and exhaling, just like a normal wave, deep breath. So I'm going to take my stethoscope, and I'm going to make sure that my diaphragm is turned on, I'm using the diaphragm side of my stethoscope. And on the posterior side, there are 8 sites, and then on the anterior side, there's 6 sites. So I'm going to be doing both posterior and anterior, listening to his lungs as he inhales and exhales. So for the posterior side, I'm just going to start above his scapula and work my way down his lungs. So just breathe in and breathe out. And I'm just asking him to turn around so we can do the anterior side. And then there are 6 sides on the anterior side, and it starts above the clavicles and works down the lungs. So again, just breathe in, breathe out.